Have you ever wondered what the differences are between breakouts and acne in your teenage years versus your older years? Well, listen on to learn about how these conditions are different and how best to treat each condition. Now, some of us are born with a genetic predisposition for acne, meaning that our skin is more prone to oiliness, blackheads and breakouts, which is likely to develop during that big hormonal shift at puberty and then potentially stay with us through adulthood to some degree. However, many of us may not have been spotty as a teenager, but then all of a sudden we start breaking out in our 30s or our 40s. Now, this is usually due to factors such as increased stress levels, diet, including high glycemic and dairy foods, things like poor sleep, medications, even UV exposure and pollution, and not forgetting female hormonal fluctuations from our monthly cycle, pregnancy, and even menopause. So what are some of the key visible differences in acne breakouts as a teenager versus an adult? Well, when we start going through puberty, the spike in sex and growth hormones really drives oil production and skin cell turnover. So typically in your teens and your early 20s, your skin is oilier and it's more prone to blackheads and spots. If we compare that to a woman, say in her 30s, she'll tend to have less oiliness and blackheads, but suffer with red angry spots that tend to stay around a lot longer. Now, when we look at acne in teenagers, it tends to affect the centre of the face and then work its way outwards. So typically it covers the forehead, the cheeks and the chin, and then you get a combination of blackheads on the T-zone with excessive oil production. In adult acne, and we'd classify that as being 25 years and older, the breakouts tend to manifest in this lower face area, so around the chin, the jawline and on the neck. Blackheads and excess oil are typically less of an issue, and interestingly, this lower face area is very responsive to hormones, meaning that high levels of stress hormones and fluctuating female hormones can really cause breakouts in this localized area. Another key difference is that younger skin is more resilient to its environment and it heals quickly. But unfortunately, as we age, our skin is less tolerant, it's also slower to heal, and so we suffer with more inflammation and more pigmentation marks. So we can see there are physical differences in teen versus adult breakouts, and the causal factors also differ. So this really influences how we approach treatment with skincare. Now, there are some key healthy skin tips that you can follow regardless of your age to keep breakouts to a minimum. So they would be things like double cleansing the skin every day, regular exfoliation, using targeted serums or spot treatments, and also defending your skin from the environment. But it is really important that the formulas are suitable for the type of breakouts that you are targeting. So at Dermalogica, we have two systems of products. One is designed to target the needs of teen skin, and one is designed to address the challenges of adult breakouts. Now, our Clear Start line, this is for teens and young adults prone to more oily and that breakout prone skin. Every product in the Clear Start line contains active breakout fighting ingredients as well as soothing natural botanicals that keep skin clear, hydrated and balanced. Our active clearing line, this contains multitasking, brightening and clearing formulas, and they really help to actively increase cell turnover, which is a process that slows with age, and keep skin clear of breakouts while promoting an even skin tone, all without overdrying an already sensitive adult skin. The full active clearing line is great for adults with persistent breakouts and congestion, but if you developed breakouts later in life, our new Age Bright Clearing Serum and our Age Bright Spot Fader can be really easily slotted into your current regimen. Now, whatever your age and your degree of breakouts, there is a Dermalogica solution for you. So if you need some expert advice, please don't forget to seek out your local Dermalogica therapist who would love nothing more than to guide you to your healthiest, clearest skin.